Good afternoon. Today we're going to talk about our efforts to trace COVID-19 clusters across the Commonwealth, launch a new public awareness campaign to remind folks about the importance of wearing face coverings and masks. But before we go there, I do want to spend a minute talking about the Commonwealth's commitment to local aid and funding and providing clarity for municipalities with respect to their budgets. Obviously, we're working to fully understand the impact of COVID-19 and how it will affect the Commonwealth's own fiscal situation. That's caused delays with respect to the release of a final and full fiscal 2021 budget. However, we do know that cities and towns rely on the state's budget so that they can have clarity with respect to state aid for schools and other general government services at the local level. And that's why yesterday we announced that for fiscal 21, our administration and the legislature are committing to providing cities and towns no less than the fiscal year 20 level of funding for unrestricted general government aid and school aid funding. This funding commitment also provides an additional $107 million in Chapter 70 aid compared to fiscal 20. This agreement, in addition to the federal aid dollars distributed to all cities and towns, adds up to well over $1 billion in new funds to ensure schools can fund the changes that they need to make to teach kids this fall. All in, this will more than fully fund the Year 1 Student Opportunity Act that we filed back in January. And despite the almost unprecedented fiscal challenges that we all face, we're all committed to continuing our historic support for local communities and schools, and we look forward to working with our colleagues in the legislature once the dust settles at the federal level to produce a final budget here in Massachusetts for state government. With respect to our daily update on tests, yesterday DPH reported test results for over 12,000 individuals. That brings the total number of tests that have been administered in the Commonwealth to over 1.5 million. There were 304 new positive cases reported, and like Wednesday, the number of cases appeared slightly higher yesterday because there was a delay in the reporting to DPH from a large hospital group. DPH has assigned these positive test results to the appropriate date of the test retrospectively. In total, there have been 109,400 cases of COVID statewide. The 7-day positive test rate averages at about 2%. That percent positive rate is slightly higher and has increased over the last few days, going from about 1.7% to now 2%. We're obviously monitoring this closely, but simply put, it's a reminder to us all that COVID's not taking the summer off and we must all respect the virus. 367 patients are hospitalized for COVID-19, and of that, 55 are in the ICU. The 3-day average number of patients hospitalized is down about 90% since the middle of April. And currently 4 hospitals are using surge capacity, but it's not related to COVID. For the most part, the people of Massachusetts have done the right things over the past couple of months, wearing face coverings, social distancing, staying home, limiting gatherings, practicing good hygiene, and washing their hands. Businesses and communities have gone to great lengths to follow the sector guidance that was developed by the Reopening Advisory Board that was chaired by the Lieutenant Governor, and have found safer ways to operate after being closed for months. Because of the diligence of every resident in Massachusetts, we've driven down transmission rates and hospitalizations, as I said before, by 90% plus. In June, we were reporting between 10 and 12 positivity rates for testing. Currently, we're hovering around 2%, up from 1.7% several weeks ago. This has been made possible by the collective efforts of everybody here in Massachusetts. But COVID does not follow any rules. We should not and cannot let our guard down until there's a treatment or a vaccine. Look no further than other states that have seen dramatic increases in new cases with uncontrolled outbreaks. We do not want to see that happen here. Now, we say that recognizing and understanding the importance of socializing and seeing friends after so many months of staying home and socially distancing. But recently we've seen disturbing reports of large gatherings where people are letting down their guard, not wearing face coverings, not socially distancing, and giving the virus the opening that it relentlessly seeks to spread. Unfortunately, these gatherings are resulting in new COVID case clusters and ramping up the spread of the virus. As I said before, our daily data report's been showing a slight increase in COVID cases. These lapses in judgment, these missed opportunities to keep the door that we all work so hard to close shut, are contributing to a slight but important rise in positive cases here in Massachusetts. Some of the cluster incidents that are being investigated by the Department of Public Health include a large lifeguard party in Falmouth, a house party in Chatham, an unauthorized football camp in South Weymouth, a high school graduation party held in Chelmsford, and a large house party in Wrentham. Just yesterday, we heard about a 90-person prom party that was held in Cohasset that's now being investigated also as a possible cluster. These gatherings were planned by both adults and young people and demonstrate an at times unwillingness to accept the fact that this virus is extremely contagious and in many cases invisible as it spreads. We've said many times before that a significant portion of the population that gets infected by COVID will not show symptoms, but they can and often do pass the virus on to others who do get very sick and in some cases die. Anecdotal evidence in Massachusetts makes clear that this has happened a lot over the course of the past 4 months. Another gathering that was in the news this week was at Bay State Health Systems, where people got lax about wearing coverings in the break rooms. Now they're dealing with dozens of cases. There was also a party on a private boat in Boston Harbor that's currently also under investigation as a cluster by the Department of Public Health. After battling COVID for months, our healthcare experts know that transmission is more likely in very large groups, where people aren't wearing face coverings or socially distancing. This behavior dramatically increases the likelihood of COVID-19 infecting other people, and this virus can, and in many cases does, take off like wildfire. The situations I just recapped are a recipe for disaster and need to stop if we want to continue to reopen and get back to a new normal in everybody's lives here in Massachusetts. Things are definitely different because of the virus, but there's a responsible way to gather with loved ones and to celebrate important milestones. People need to do their part to protect their families, their friends, their neighbors, and their communities. If you're having an event outside or inside and can't social distance, wear a face covering. The evidence on this is clear. Face coverings stop the spread. Don't share food or drinks, and use common sense. Our current guidance limits indoor gatherings to no more than 25 people. It took us a long time in Massachusetts to get to the point where folks could plan small gatherings to celebrate birthdays, graduations, weddings, and other special events. To visit loved ones in senior care facilities was shut down for almost 4 months. As I said before, I didn't see my dad for over 100 days. But if we continue to see a rise in new cases and changes in our public health data, we'll have to consider a number of options, including reducing the gathering size back down to a smaller number. People also need to be responsible about traveling. Last week we announced that on August 1st, the Commonwealth will have a new travel order for all visitors and returning residents. Folks arriving in Massachusetts from any state that's not been deemed lower risk for COVID-19 will be required to complete a travel form and quarantine for 14 days. People do not have to quarantine if they can produce a negative COVID-19 test that was taken within 3 days prior to their arrival. The new order also applies to Massachusetts residents that are returning from out of state from high-risk states. Those who don't comply can be fined up to $500 per day. Please visit mass.gov/MAT Traveler for more information. We all have a role to play in being vigilant about observing these common sense precautions. When clusters come up, the Department of Public Health works closely with the local boards of health and our community tracing collaborative to identify, investigate, and follow up with potential contacts. DPH is available to provide additional support to local health departments, and if they need more resources, they can make it happen, such as help with testing and tracing support. Contact tracers with local health departments and the community tracing collaborative are working around the clock to reach out to these contacts and provide them with information and support about how they can safely isolate themselves. As of this week, almost 141,000 cases and contacts have been connected with either the local Board of Health or with the Community Tracing Collaborative. Contact tracing has been critical to helping to mitigate the spread of the virus as we identify clusters, because we can then get in touch with folks before they transmit the virus to others. This is a reminder to everybody that if you get a call from the Tracing Collaborative or your local Board of Health, please answer the call and work with the contact tracers, because that is an incredibly effective way to stop the spread. But the best way to deal with a cluster is to not have one in the first place. Businesses are open, the weather is good, go outside, enjoy yourself, and do the things you know you have to do to slow the spread. Honestly, it's really as simple as that. We want to continue to be able to safely open the Commonwealth. And so far, our employer community and their employees have been incredibly good about following the rules and the guidance. But we'll not be able to continue to reopen Massachusetts if people can't maintain the same discipline that they bring to work in their private activities. Clusters from private parties are still clusters. You can't turn them off when you're at work. As we talked about before, masks and face coverings are among the most important tools we have to fight COVID-19. This virus is transmitted from person to person primarily through our noses and our mouths. And the way we stop that transmission is by wearing masks, socially distancing, and washing our hands. Wearing masks helps protect you, but it also helps protect those around you, like your friends and family and neighbors. Back in May, we issued an order requiring people to wear face coverings when they're in public and unable to maintain a safe social distance. We've been pleased that since then the people of Massachusetts have done their part by wearing face coverings. But if we want to prevent clusters from popping up in the future, we need to ensure that everyone continues to do their part by wearing masks when they're in public or when they can't socially distance. And that's why today we're launching our #MaskUpMA campaign. This effort will continue our work to remind the people of Massachusetts to wear face coverings to help stop the spread of COVID-19. The campaign will consist of social media testimonials, an updated PSA from the Department of Public Health, and a website, www.mass.gov/maskup. This morning we lost our first video testimonials from the Lieutenant Governor and from me. We're also joined today by the Red Sox mascot, Wally the Green Monster, who checked in from Fenway Park. He was also wearing a mask. We're going to show some of these videos today, and in the coming weeks we'll build on this effort with other partners. Residents are also reminded to go to www.mass.gov/maskup for best practices and multilingual resources about wearing masks. Together, we can all do our part to keep our friends and family safe and healthy. And we must. Thank you. so funny to see him without a crowd. Questions?
Governor, how high does the positive test rate have to go to trigger you to reduce gathering sizes or roll back other reopening?
Well, we've talked before about the fact that we wanted to get below 5%. That was our original goal. But obviously, we exceeded that over the course of the past few weeks. And I think what I would say at this point is it's going to depend on a confluence of elements associated with the things we look at. But from our point of view, we've seen troubling clusters developed primarily as a result of not so much the reopening of the Commonwealth's economy, but related to issues associated with private recreational behavior. And I think from our point of view, if we continue to see rises in positive test rates, we're going to have to make some changes.
Governor, we heard from Mayor Walsh today regarding schools. Still no decision for Boston schools. We know school districts are giving their proposals, at least where they're leaving. And then August 10th, another said, but for parents trying to plan in September, when will a decision be made for when the students are going to go back, if they're going to go back in person?
Yeah, well, I think part of what we tried to do here was, first of all, make sure that people had clarity about resources. And we think at this point with this announcement today, admittedly it's late, but to some extent we've been playing a difficult hand driven by a lot of issues with respect to how we could put our data out with respect to funding for local communities and schools. But at this point you're talking about a situation where cities and towns are basically being guaranteed through that local aid agreement and the federal money that's come through associated with the Corona Relief Fund, that cities and towns and schools are going to have more resources available to open schools in the fall than they would have had under the Student Opportunity Act. So that's like big question number one. Big question number two is the guidance. Most of the guidance that's been developed by the Department of Elementary and Secondary Education has been developed both in conjunction with the public health community, the infectious disease community, also with the experience that's been had by other school districts, both in the U.S. and around the world, that have opened and demonstrated successfully that they can reopen. And obviously, as we've said many times, we've been doing this in conjunction with our own pediatric, public health, and child welfare communities here in Massachusetts, all of whom have expressed a desire to see kids get back. What DESE put out was a recommendation that communities submit 3 options: a full reopening option, a hybrid option, and a remote option, based on the idea that school year is a long time, and it would be good for school districts to have each of those options something they thought about and planned for, depending upon what the actual facts on the ground are for them over the course of the year. But I think we want to see kids get back to school, because all the evidence is that it can be done safely, and that for many kids it's a really important part not just of their educational development, but also of their social and their cultural development. And the final thing I'll say about that is, every teacher I ever had when I was growing up always said, you probably won't succeed at something if you don't try, which was advice I've never forgotten. And I think at this point, the resources are there, the guidance is there, the experience in many other places is there, and what we should hope and anticipate is that the grown-ups will do all we can, working together to give kids a chance to have the experience that the pediatric community, the public health community, and others believe is the most important experience for them, which is a chance to go back to school. And to use those other 2 approaches if they become necessary based on, again, facts on the ground in those communities.
Jesse told me today that it's going to be up to those school committees what form of school, what it looks like for each particular district. But we know that you shut down schools statewide back in March. What would it take from a health data standpoint for you to not allow students to go back physically in the fall?
With a statewide positive test rate of 2%, and I think a handful of really small districts that are over 5 at this point, I think Massachusetts is as well positioned as anybody to pursue a strategy to try to get kids back to school, especially with the support and guidance we've gotten from the public health and pediatrician community and from others.
Governor, so putting a fine in place an option for not wearing a mask mask in public? Is that something that's in your toolbox that you might be able to go to?
So-
Or sanctions for
Yeah.
groups that might put on a football camp or a prom or anything like that? Are there those kind of
So under the order that we issued back in May on face coverings, we basically gave local communities, who for all intents and purposes are in much closer regular contact with respect to what's going on in their communities on this, we gave them the authority to issue a fine up to $300.
Governor, local boards of health in the state say they do not have the manpower to enforce the new travel order. How do you expect to do this? Are there any plans in the state to provide additional resources starting this weekend?
That's it. That's the first I've heard of that. So we'll certainly, and we were actually on a call with them this morning. So we'll certainly reach out to them. And if there are particular ones that you think we need to speak to, you should just tell us offline who they are, and we'll call them.
Governor, you said that you manage tracking and monitoring people who would travel to Massachusetts, let's say, on the highway from a state that's not yours.
Yeah, the highway, the roadways are obviously a different circumstance than the airports and the train stations. And the states that I would describe as sort of those that are contiguous to us, plus New Jersey and New York, which is where most of the automobile traffic comes from, all for the most part have positive test rates that are pretty similar to ours. Our big concern here was more about what I would describe as sort of folks from the Sun Belt and some of those other areas where you have positive test rates that are north of 10 and 11, 12%, or folks coming from some of the areas in the middle and the far west part of the country where they also have positive test rates that are significantly above that. And the vast majority of the traffic coming from there is coming by plane. I will say this, the travel form website has had over 1 million hits since we put it up, and there are 8,000 people so far who have filled out the form. Already, yeah.
You said these COVID clusters in several communities that are being investigated. So could these groups potentially face fines or be cited in some way?
I don't think there's a fining process associated with that type of these are private recreational behaviors. I mean, those are the sorts of things that you would hope people would bring the same discipline to that they bring to with respect to their, days at work, or their trip to the grocery store, or whatever other circumstance or situation they find themselves in, where people do tend to wear face coverings and to socially distance.
Governor, do these clusters involve younger people at parties, and if so, how do those of us with a few gray hairs get through to the 20 to 25-year-old people?
Do you want to speak to this? Because it really hasn't seemed to us that this is just about the kids. It really hasn't. Do you want to talk?
As one of those gray haired people. Many of the parties are actually organized by adults and kids. So the prom parties in someone's backyard has been organized by and attended to as same number of adults as it is young folks. So the message that the governor is conveying is to both adults who are responsible for organizing the parties in their backyards and their private gatherings, as well as to the youth, that there are ways to celebrate these important milestones of high school graduations and other events, but do it responsibly. You can wear masks, don't share food, don't share drink, right? Don't do the buffet, and celebrate these milestones. So it is really the messages to adults as well as to young folks that you can have a good summer, you can celebrate these milestones, but we need to do it responsibly in order to continue to drive down the numbers in Massachusetts for us to continue to reopen everything.
And you're saying these parties, these gatherings in these communities that you cited are responsible for upticking COVID-19 cases in those communities?
So what we're saying is what we are seeing is it is a contributing factor. Likewise, you're seeing the number of cases increase as well as our positive test rate, and we've seen a number of clusters over the past few weeks emerge that need to be investigated as potential clusters. And as you know from a cluster, if I use the informal or unauthorized football camp, that involves 17 communities where there are kids. So imagine if there are multiple folks who then test positive and the potential of the spread of the transmission of the disease.
Have you traced any cases back to that camp? Or
Yes.
You have.
Not me personally. Yes. Cluster investigation is detective work. It's public health detective work. So someone tests positive, you ask where they were, then it connects to other people. So yes, there's been, and a cluster is really two individuals who are not like connected, like married or living in the same household, if you would, right? But they're connected to an event or a place. And that is what then starts a public health investigation into a cluster. And yes, in the case of the informal, illegal, unauthorized football camp, it is several individuals who have tested positive now.
And what about the other gatherings that you cited? Have you been able to trace back to those as well?
So the ones that the governor has mentioned in his remarks are active public health investigations of clusters of which there's been more than one individual tested positive. Yep.
Secretary,
Yep.
Governor, and what?
Okay, he's governor.
For both of you. At what point with the daily number of cases and the positive test rate, at what number do you pick where this really starts to be more concerning?
So I am concerned because we have done such an amazing job in Massachusetts of being vigilant and driving down both our positive test rates, our overall cases, our overall hospitalization rates, any metric you want to use. Number of people in ICUs, number of people who've recovered. So the fact that we were at 1.7% positive test rate for a period of about, I think, 10 days in July. I don't have my notes right in front of me. About 10 days, and then we've just started to see, and it's a trend. It's a slow creep. And so what we're saying is we want the slow creep to stop and start trending back down. And I think the fact that we're talking about this today is we have the ability in Massachusetts, because we've demonstrated that ability, to drive it down. And that's really the message today. And we know face coverings are effective as very much a part of that tool. And we want to remind people to wear face coverings when in public and social gatherings and the like. I don't know. The governor may have.
Would you agree this is a tough ask? Because New England winters are horrible. People live through the summer. It's like 2 or 3 months where they really get to let their hair down and have some fun. So culturally, it's difficult for us, right?
I think, I think a lot of things associated with the changes people have had to make and the way they live to deal with COVID are difficult. I think, but I guess what I would say is, for me, this all goes back to some of my earliest conversations with some of my friends and colleagues in the healthcare community. It seems like a really long time ago, but in March and April, without the kind of knowledge they have now about how to manage people who are dealing with COVID, without the kind of gear that we eventually, working with them and with others, found and got them to deal with this, without the kind of experience set with regard to how they were going to deal with how they moved their staff around and how they dealt with infection control and all the rest inside their own institutions. Our healthcare community, buckled up every day, many of them working in double shifts in some cases, to find a way to try to save and protect as many people as they possibly could under incredibly distressing and difficult and challenging circumstances. And when I talk to any of those people now, they say, I am so grateful that Massachusetts finally got to the point where we could actually catch our breath, figure out what our staffing models needed to look like, actually maybe have a day off once in a while, and not spend every moment of every day worrying about how many people I was going to have to try to save or lose when I came to work. And for those people, this whole question about how much we collectively are willing to do to keep ourselves and our neighbors and our friends healthy is a big benchmark. Because if this whole thing goes south, It's going to land on them. And they're the ones who just finished helping us dig out under really trying circumstances. So as I sit here and I think about, the difficulties associated with not being able to see my dad. I mean, I haven't had a meal with my dad in 5 months. There are rules here, and a lot of them are a pain in the neck. I just saw the folks in New Bedford canceled the Blessed Feast of the Sacrament, which is one of our all-time favorite events. But this kind of stuff, sports events without fans, what is that? Okay? But the bottom line here is the ask for the people of Massachusetts, so that all your friends who work in the healthcare world can maintain an ability to deal with all the things that they deal with in addition to COVID, is a pretty small one. So wear a face covering if you can't distance. Use your head about sharing food, drink, and all the rest. Respect the virus. And don't do the large gathering, close contact things that create super spreaders and clusters. So that people can work, pay their rent and their bills, and our healthcare community can sort of find its way back to some semblance of being able to juggle the stuff they normally used to do and their COVID cases. I mean, we've had a lot of people, both of us, all three of us, in conversations with folks in the healthcare world who talk about how much more they can do for people who are dealing with COVID now, A, because they know much more, but B, because they're not under siege. And not struggling just to figure out, how to find beds for people or equipment for them or the right staff. So, and I guess I would just ask people to think about it through that lens, because to me, those are your friends and neighbors. They did save a lot of people's lives. And more than anybody else, they're rooting for all of us to do the right things to manage the spread, so that we don't put them back in the same kind of situation they found themselves in March and in April.
Last question. It's come over to September 13th, about 6 weeks from Sunday. Have you been approached by one of the pages of the NFL about a plan that they're floating to put about 20% spectators in the fan, be about 13,000?
Have they presented something to you guys?
Have you been approached, and if you have, are you inclined to approve such a plan?
We did receive a very thorough presentation from the managers of the facilities at Gillette. It is a comprehensive plan. It's obviously unique and never been done before, and it's under review by our reopening board.
A question about Holyoke and kind of there's been a bit of a relapse out there when patients and staff have tested positive. Are you going to be checking other healthcare facilities about these relapses?
We're actually doing a lot with that, and why don't you just go ahead and speak to it?
So I don't know if I would characterize it as a relapse. I would say that what happened at the Holyoke Soldiers Home and the veteran who had symptoms of COVID-like symptoms, the staff responded exactly the way we'd want them to respond. They responded swiftly. He tested positive. He was transferred to acute medical facility hospital where he's continuing to be treated, and he's subsequently tested negative. He was on a recovery unit, so individuals who had tested positive are on a designated unit for people who had tested positive and the like. His roommate has tested negative, and all the staff and the residents have been retested, and 7 staff have tested positive. they were asymptomatic, and they were all at home until such time that they test negative. Or the days elapsed. So I wouldn't say it was a relapse, but it is a reminder that COVID, it remains with us in the Commonwealth of Massachusetts. As of July 19th, we have retested the skilled nursing facilities, and again, as part of our ongoing surveillance of congregate care facilities. There's a very active program, not just for skilled nursing facilities, but other congregate care facilities in Massachusetts, which would include things like group homes, our large public mental health facilities, DD facilities, and the like. So there's an active surveillance program going on.
Governor, could I ask you about some time ago when we were in the thick of it, you were talking about 45,000 tests a day right now. And
Capacity to do 45,000.
But I thought then you said we're going to do 45,000.
No, I said I hope I said, if I didn't say it, I should have. We wanted to have capacity to do 45,000.
Do we have that capacity? So we could be doing 45,000 tests a day right now.
If we had 45,000 people's worth of tests to do. I will say this, I think when the colleges come back and they're all expected to have very comprehensive programs around infection control, testing, and all the rest, I do think when they come back, you'll see a very big increase in the daily test rates in Massachusetts.
So all that federal money, you've spent it already?
Oh, no. We've probably encumbered around 40 million of the 374.
Governor, on the budget, are you in agreement on a 3-month interim budget to take us through October?
I think that's the only choice I've got at this point. What I would say is that the legislature, I understand the legislature's concern about not knowing what the feds are going to do, and the feds in this particular situation are a really big footprint in how this all plays out. That's why I'm glad we did the local aid piece for cities and towns, so that people know at least that and can take the Federal CARES Act money, some of the direct funding that they got for a variety of different things, plus the unrestricted government general aid money, plus the Chapter 70, and put that into a package and say, okay, now I know what I've got when it comes to state and federal resources in the big buckets on a go-forward basis. But I think the bottom line is the legislature really wants to see what is going to happen in Washington before they sort of put the final ink on what they would like to see as our FY21 budget. And I'm sympathetic to that, and I think that's probably at this point in time the best we can do if we want to do something that's reasonably accurate. Thanks, everybody. I have not signed it, but it's going to get signed. Yeah.